Hi and welcome to Nurse Only Videos. This episode I'm going to show you how to troubleshoot the problems when doing blood sugar levels testing. It might seem straightforward. You think, oh, it's quite uncomplicated. What do? Just prick your finger, put a test strip in, away you go. Yes, it can be, but there are some things that you need to look out for. So things that you need to look out for is, firstly, make sure that your hands are clean. So if you have dirty hands, like if you've eaten donuts, I always harp on about donuts, but it's just because you get a good visual. Donuts have all sugar on the outside, and if you had your sugar on your fingers and you pricked your finger, then did the test, you're going to get an artificial result because you can have the sugar going in there too, so it's going to read high for no reason. So always use warm water to wash your hands. Now, when you use warm water, because diabetics do have decreased sensation, test the water with another part of your arm first to make sure it is warm. Alright, and the other thing, good little tip, is turn cold water on first before hot, so you can warm it up. But it is hard for diabetics to judge the temperature. Other things to do is, if you're doing like second hourly or hourly blood sugars for a couple of days, you know, you've only got 10 fingers, where do you go on each side? You're going to run out of spots very quickly. So choose different spots around the sides of your fingers. Never go the tips, because of nerves run to the ends of your fingertips. If you start pricking there, you'll actually cause more nerve damage. Also, it's more painful when you're doing a finger prick at the top. So always go up the sides and choose a couple of spots on each finger, and then that gives you more time to get to the other hand. So when you're on this hand after 24 hours of doing hourly tests sort of thing, this hand's starting to heal up a little bit at least for you. Choose the appropriate lancet size. Try and get the smallest one to get you a blood test. So it's a little capillary test, so you're not going for a vein or anything. You're just going for a little drop of blood. So you only need it to go the smallest distance in. There are different sizes depending on how much blood you need. But if you can go the smallest possible, that is always good. Other troubles are the glucometer itself. The batteries can be flat, so always make sure you've got a spare battery for that time when it comes. Check that the test strips match the number in the glucometer when you plug it all in together. They've got to match. If they're not matching, you have to recalibrate, and we've just done another video on that, so check that out. Other things that can occur is no blood coming out. So if you find you've pricked your finger and you're getting no blood, don't squeeze the end of your finger like that, because what that will do is break all the little blood vessels and cause more glucose to be in your finger than what's actually in your body. If you do have trouble, the warm water that you've washed your hands will hopefully dilate your blood vessels a bit. Turn your finger upside down. I'm only holding it up because I'm showing you on camera, but hang it down next to your knee or something. Let the blood run down and then prick the side of your finger, because that way you got better chance of getting blood there. If you need to massage it a bit, massage up the finger. So start at the third knuckle and move to the second knuckle, because then you're not actually putting direct pressure here, like squashing all the blood vessels, because that can be a big problem. A longer term problem of doing blood sugars for a long time, because you'll see you'll get bruises and little holes everywhere. Those little holes, because you're breaking the skin, can be a source of infection. So make sure that your hands are generally clean all the time anyway. If you're doing anything dirty, wear protective gloves, because they are a real good source of getting infected, especially being diabetic with the blood's a bit, stickier. Bacteria love to get in there and cause you problems, so you don't want to get all that. So there's a few little tips to hopefully keep you out of trouble. If you do experience anything else, give us a call or just leave a comment below and we'll try and answer you back too. So my name's Phil, I'm here to help you care, and look forward to seeing you in the next video. Bye bye for now.